Chapter 21. In this chapter, you will learn about the common injuries related to the thigh, hip, groin, and pelvis. We will also cover the assessment of the thigh while discussing the mechanisms of injury, signs and symptoms, treatment, and rehabilitation. Please use the PowerPoints to guide you in your reading. Please review the anatomy of the thigh using the PowerPoints and textbook information. A compression force causes a quadriceps contusion. This might be the force of another player's knee, or as shown in this picture, a soccer ball. The contusion can be minor, first degree, which would include symptoms of tightness or soreness. A bruise may or may not appear. There is no reduction in the range of motion. In a second degree, moderate, there is more pain, swelling, point tenderness, and the athlete cannot flex the knee more than 90 degrees. In a third degree contusion, severe, there is moderate to severe pain, swelling, and a range of knee flexion that is 90 to 45 degrees. The athletes will also show an obvious limp, and there might be muscle deformity. The management is RICE, but should also include flexion to the point of slight discomfort. If the athlete is limping, he or she should be given crutches for assistance in walking. The complication is Myositis Ossificans. We covered this during the first week of the session, so please refer to this PowerPoint as needed. It is important to control the initial bleeding and refer the doctor for treatment if a large hematoma develops. Also, too vigorous treatment, including excessive massage, ultrasound therapy, or heat to the thigh, can create inflammation, leading to myositis ossificans. The athlete with myositis ossificans must be treated very conservatively to avoid further calcium deposit. If pain, muscle weakness, and decreased muscle function continues, surgery is performed to remove the bony deposit. A quadriceps strain occurs because of a forceful contraction of the hip and knee into flexion while the hip is extended. It can also happen in the opposite direction, with the quadriceps being overstretched while the hip is in extension and the knee is flexed. The signs and symptoms are similar to a quadriceps contusion. This strain can be considered minor or first degree and would include such symptoms of tightness or soreness. There would be no reduction in the range of motion. In a second degree, there is more pain, swelling, and point tenderness, and the athlete may limp or may not be able to flex the knee more than 90 degrees. In a third degree strain, there is moderate to severe pain, swelling, possibly a noticeable defect or indent in the muscle, and the athlete won't be able to extend the knee actively against resistance. The management is RICE, the use of crutches if the athlete is unable to walk without limping, the use of a neoprene sleeve for compression and support, and gradual progressive range of motion stretching and strengthening exercises depending on the grade of the injury. Hamstring injuries are the most common thigh injuries. There are many theories that support this fact. First, the biceps femoris, the outside hamstring muscle, which sustains the most hamstring injuries, has a unique nerve firing in that it contracts at the same time as the quadriceps muscle. This is similar to having pistons misfiring in a car. Another contributor is that the hamstring stabilizes the knee while extending the hip. This dual function may cause its injury. Other reasons of hamstring strain include muscle fatigue, faulty posture, a leg length discrepancy, tight hamstrings, improper running form, and an imbalance of strength between the hamstrings and quadriceps. The hamstring should have 60 to 70% strength as the quadriceps group. First, second, and third degree strains have similar signs and symptoms as the quadricep muscle. However, in second degree, You will often see the athlete pull up as if someone shot him in the leg. Treatment is also similar for the hamstring as the quadriceps. It's important to acknowledge and address the numerous causes of hamstring strains so that they can be focused upon during rehabilitation. Although fractured femurs are rare in sport, they are life-threatening due to the accompanying level of shock and possible bleeding. They are caused by a significant blunt trauma or extreme fall to the leg. The signs and symptoms will be extreme pain, and the athlete will guard the muscle and will be in the most comfortable frog leg position. Your management requires the implementation of your emergency action plan. Treatment at the hospital will include open or closed reduction, followed by lengthy rehabilitation. Review the anatomy of the hip using the PowerPoint and the textbook information. Running, jumping, or twisting with external rotation produces the groin strain. The worst injury I observed as an athletic trainer was when a basketball player ran onto the recently wet-mopped court and proceeded to do the splits. She strained both groins and was out for 4 weeks. Men usually experience groin strains more than women because of their lack of flexibility in this area. Groin strains can be very challenging to treat as any movement reproduces pain. Common signs and symptoms include minor twinges of pain to feeling a pronounced tearing sensation after active movement. It will produce pain, weakness, and internal hemorrhage resulting in extensive bruising, as seen in this picture. Treatment includes rice, groin and thigh braces, heat therapy after 72 hours, and a progressive stretching and strengthening regimen. The athlete must achieve 80% of the strength of the non-injured groin to return to activity. This is the general rule for all muscle strains. The piriformis muscle is V-shaped and connects the femur to the hip. It enables the thigh to laterally rotate at the hip. The piriformis sometimes compresses the sciatic nerve, causing pain in the buttocks that possibly radiates down the back of the thigh. The signs and symptoms of piriformis syndrome include a deep pain in the buttocks with possible radiation down the thigh and down the leg. The treatment includes stretching and anti-inflammatories to reduce tightness and swelling. Note the stretching exercises available on the PowerPoint slide. Chiropractic manipulations and adjustments of the lumbar spine and pelvis will assist in alignment and correction of piriformis syndrome. The hip pointer is a contusion to the iliac crest. This is a painful condition because there isn't a lot of padding over the iliac crest. It causes a severe pinching action to the soft tissues. The signs and symptoms include pain, spasms, and increased difficulty flexing the hip and rotating the trunk. Treatment includes rice and referral to a physician if the athlete's pain is severe or if he or she is having difficulty moving the trunk. One must rule out an avulsion fracture to the hip. Ice massage and ultrasound assist in the healing process, and padding of the hip is recommended to prevent further injury during play. Refer to the next slide for comic relief after your hard work reviewing the content of Chapter 20 and 21. Review the rehabilitation section focusing on the stretching and strengthening exercises for the thigh, hip, and pelvis. Once you have completed this chapter, you are ready to prepare your responses to the forms listed under Session 5. Congratulations.